Welcome to eZeLiving.com. Today we're talking about facial rejuvenation with Dr. Luis Toledo. Welcome, Dr. Toledo, and thank you for joining us.
Thank you for having me.
Can you start out by just explaining what facial rejuvenation is?
Well, at some point in life, when you look at yourself in the mirror and you think that that image doesn't reflect what you feel inside, that you're feeling old when you look at your image, then it's possible to go to a plastic surgeon to do something about that and match the image to the person that you are.
So what age do you go from having things like fillers to then going to having surgery?
Yeah, fillers are something that depends on the aging of the person, depends on the type of skin. And many patients, I've done eyelid surgery on a 23-year-old girl because she had very puffy eyelids and that made her look very tired and very old. But usually around 35, you start with the mild things, that the non-surgical facial rejuvenation, such as fillers and Botox. Botox is to paralyze the muscles and reduce the wrinkles. And fillers is to fill in the areas that need some volume, like the folds and some of the wrinkles as well. So we can, with this simple procedures, we can already enhance the face and postpone the first facelift.
Right, okay. So tell me, what sort of developments or advances have there been in the surgical rejuvenation?
Surgical rejuvenation started about 10 to 15 years ago to get the minimally invasive techniques. Techniques that substitute the old long scars of the facelift, the traditional facelift, which we call rigidoplasty, to much smaller scars, and separating areas of the face. For instance, if you have a problem in the neck and you don't have a problem in your eyes, you don't do the eyes, you just do the neck. If you have a problem of the mid-third of the face, which is this area here, and you don't have any problems on the neck, we just do that. So the so-called mini lift. So we can split that surgery in smaller procedures. And this is the good thing. We call it maintenance. We don't let everything go down and then suddenly show up with a totally different face. This is not the right thing to do. You just do the maintenance every 2 years. It's like going to the dentist every 2 years to see if you have any cavities.
So when you have these procedures done, is it something that is absolutely noticeable? So can you have it tweaked, or do your friends or family, etc., know that, oh, they've had a facelift? Because you know, so many people you see that, or maybe the older days, where they had this really stretched look.
Yes.
Is there a more subtle way?
One of the main changes that we saw between the old facelift techniques and the modern ones was the inclusion of volume on the face. Because before, people thought that just to rejuvenate means stretch. Right. So you would stretch the face and you think it was young, and it was not young, it was old and stretched. So you would have to, apart from removing the excess skin, to put volume where volume was due, because one thing that happens with age, everything goes down. You know, the cheeks go down and form jowls. You get these nasolabial folds around the mouth, the marionette lines. So apart from just stretching the face, we need to put volume where it is. So we can use fat injection for that, or we can use fillers.
Right. And what sort of people are suitable for this kind of procedure?
That men and women, we have a percentage of 20% men and 80% women in our practice. In the world, it's about 12% men, and the rest is women. And men and women over 40 usually, right, up to whatever. Yes. You know, I've done facelifts on 80-year-old patients who had facelifts before and just needed some maintenance at 80. But usually the main age for that is between 40 and 60.
Right. And is it an expensive procedure?
It depends on what you're using, the materials that you're using. You know, in some countries it can be cheaper because you have cheaper labor, you have cheaper materials, you have it's better for medical tourism to go to a country where it's not so expensive. Yeah. But not if you are going to compromise the safety of the patient, not if you're not going to use the right instruments or the right materials that might not be tested enough, might not be FDA approved, as we call it. And these things are expensive. Once you do 2-3 years of tests, and then you start injecting something that could cost 100 and it costs 1,000, it's because you have to pay for those 3 years of tests that you did.
Right, okay, so obviously it's to not go on price alone.
Yes.
So what are the criteria?
Yeah, the criteria is first, the place. Has to be an accredited hospital instead of a clinic where you're going to have surgery in a kitchen. So you have to go to a proper hospital. You have to find a doctor who is member of the local plastic surgery society. If they don't have a plastic surgery society in that country, probably this doctor is member of an international society such as ISEPS, which is the International Society for Aesthetic Plastic Surgery. And there's another characteristic, which is the Brazilian Society of Plastic Surgery. Everybody is well trained who's a member of that society, or the American Society of Plastic Surgery, the Australian Society of Plastic Surgery. So these are societies that will give you a good background on the doctor.
So if you have all of those things covered, if you go to the right place and the right doctor, is it a risky procedure?
Every procedure, every surgery has risks. What we do is to minimize the risk of the surgery, and we compare the percentage of this risk as to crossing a road. It's pretty much the same. If you look at both sides of the road when you're going to cross the road, if you cross it but there are no cars coming, then it's safe. So the same thing with surgery. You do all the preoperative exams, you examine the patient, you do the lab tests, you have a good anesthesiologist with good drugs, good hospital and good doctors, then it's you minimize the risk.
Well, thank you, Dr. Toledo, for joining us. I found that very informative. And if you have any queries or comments, then please leave them below. And thanks again for joining us. See you next time. This is Jan Hoodman on eZeLiving.com.